My name is Evan Hawkins. I'm an orthopedic surgeon at Caramount Medical. I was always good at science and math in high school, and I knew that I wanted to do something where I was intimately taking care of people, and something that I knew I would wake up every day and be happy I was going to work. My uncle was an orthopedic surgeon, and so I got to watch him and see sort of what it meant to take care of patients with orthopedic problems. And that's sort of when the spark hit me that got me interested. Orthopedics is the care of patients with injuries or diseases that affect the musculoskeletal system. So anything involving bones, joints, muscles, tendons, and ligaments is what we care for. My specialty is adult reconstruction or hip and knee replacement. A typical hip replacement is done either through the lateral or posterior incision. This is the way it's been done for many, many years, and it's a great operation. The downside is that we cut through some of the muscles in the back of the hip, which can cause more pain and a little bit of a limp within the first 6 weeks to 12 weeks after the operation. The advantage of an anterior hip replacement, and the difference, is that the incision's in the front of the thigh, and instead of going through the muscles, we're actually splitting between them. And this allows for less tissue damage, less bleeding, and generally less pain initially after surgery. And I believe that patients tend to have a quicker, easier recovery during the first 6 weeks of the operation. I had an older woman come to me. She had terrible bilateral knee pain. Both her knees were bothering her. Her x-rays showed severe arthritis of both her knees. She had previously been very active, and she really enjoyed aerobics, and that was part of the reason she came to me, is because she could no longer get through these classes. I brought up the possibility that we could do both knee replacements at once. Now, this is a procedure that in the right patient can be really advantageous because it really can reduce the total amount of recovery time. In her case, I felt that she was a good candidate for it. I felt that she was healthy enough to undergo the procedure, and we agreed together that it would be the right thing. Her surgery was uneventful, and at about 6 weeks, she was back to her exercise classes, and at 6 months, she was playing tennis again. And she still stays in touch with me. I text her from time to time, and I really enjoy getting to see her progress and, still keep that relationship going. I think Caramount Medical is special because patients develop relationships with their primary care doctor and then can go immediately next door and find a specialist. I think it's a wonderful thing for a patient to be in the system and to have access to multidisciplinary care and not have to shop around and go elsewhere for all of their medical needs. So I've been in the Hudson Valley for 3 years now. I think I left the city because I wanted more space. I wanted the outdoors. I love hiking. I love cycling. I've recently started to play tennis, though I'm not very good, admittedly. I love the sense of community that this place has. It feels to me like home. Even though I wasn't born here, I've been in New York State for 7 years, and this place really feels like home to me. My name is Evan Hawkins. I'm an orthopedic surgeon at Caramount Medical.